and it is time now for our visit with Dr. Kevin Kavanagh. He's a retired physician and founder of a national organization called Health Watch USA. Good morning, Doc.
Good morning, Jack.
How was your weekend?
I was very good.
Well, it looks like the positivity rate has gone down into the 8s in Kentucky. That's a good thing.
And also, the number of cases have fallen. The number of cases are down 40%. So that is fantastic. Now, our deaths, however, are still way too high. Remember, deaths are lagging indicators. But what we've seen is a huge surge, which happened over the Christmas and New Year holidays, which is now starting to wane. And of course, this weekend, we have another big event, the Super Bowl, which is even more problematic because a lot of people who are from different family units tend to gather. There's alcohol, there's eating, they're shouting at the TV set like that's going to help the game any, but it's still done. And all of this is a setup for spreading the virus. And you've got this along with some mixed messaging. I was just reading today how California's decided that you can have bars open during the Super Bowl, but you can't have the TV set playing, which
I thought that was it.
Yeah, that makes absolutely no sense. I think the idea there is that if you have a TV set playing, people be in the bar longer, but the seats are restricted. You're treating a few people there with an increased exposure versus many people with a lower exposure. The rate of transmission is going to be the same. So it's really going to be very problematic this weekend, and I wish people would look at what happened over Thanksgiving, look at what's happened over Christmas and New Year's, and really adjust the behavior. Is a football game worth getting yourself very sick and getting yourself in a situation where you're on a respirator? So please be safe. Just don't do the activity. Stay at home and watch the game with your family unit.
Okay, we had a question last week about Tylenol and aspirin after taking the vaccination, and I knew that you would do research on that. What did you find?
I did, and this is interesting, and I think this really does portray the fact that if you do a vaccine in such a quick time as we've done, a lot of times you don't know for sure what is happening and being able to answer all the questions. And one of the things I've done on the show is kind of now and then I'll punt and say, well, you've got to talk to your doctor about this. So I immediately, of course, went to the CDC website, and what they stated was, if you have pain or discomfort, talk to your doctor about taking an over-the-counter medication such as ibuprofen or acetaminophen. So they essentially said the same thing. However, there are some good reports. One was in Newsweek, and this to me is more logical. One is, before the vaccination, you shouldn't be taking these medications if you don't have symptoms. If you're taking them to treat a disease, of course, call your doctor before making a decision. If you have to take them because you are symptomatic, you shouldn't get the vaccine anyways. After you get the vaccination, Newsweek reported that most experts state if you're having significant symptoms, that it would probably be okay to take aspirin or Tylenol. But of course, if there's any doubt, please consult your doctor, because when you're dealing with 6 different types of new vaccines coming on board, many different variants, this stuff changes daily. So when in doubt, call your doctor.
Okay, and another thing before we run out of time here, double masking.
Yes, that has also been a big issue on the media. And basically, 2 bad masks do not equal 1 good mask. You want to have a well-fitted mask as your first layer. If you want to use a second mask, that will add some protection, provided the first one is well fitted. If all you're doing is piling on masks and you're breathing out the sides, that's just going to encourage more air coming in and out of the side of the mask. So being well fitted is number 1. And of course, you should also consider wearing goggles or a face shield on top of the mask if indeed you're going to go into an area where you're going to have a lot of contact, especially if this is indoors.
All right. Dr. Kevin Kavanagh, thank you, sir.
Thank you, sir.